Hi, it's Lindsay with Mommy and Lactation. On this Pearls for the Girls, I am excited to chat a little bit about breastfeeding babies with a cleft lip or palate. A good friend of mine reached out and asked if I could speak on the subject. As you can imagine, having your baby born with a cleft lip or palate adds some dynamic to the feeding experience. It can be complex, and so depending on the degree of the cleft, some moms are able to breastfeed their babies if they can figure out how to make a seal with the position and allowing the flesh to actually close the palate or the cleft lip or the cleft palate. So not easy, incredibly difficult to do, very difficult to maneuver. But if your baby has a cleft lip and is not a cleft full palate, oftentimes we can manage having the baby in somewhat of an upright hold where we can kind of assist the baby in closing that cleft with the breast tissue. Oftentimes kids with cleft lip or palate cannot maintain suctions. They can't actually transfer very well. So one thing we can do is breast compressions. And so as seen in my previous videos, breast compressions are very different than hand expression. So hand expression is where like our thumb and our fingertips are pretty close to the areola. Breast compressions are very different. You're actually gonna like touch your rib cage with your fingers and put your thumb way up high. The idea is this big wide C hold is actually engaging the entire breast, okay? And so if you are a mom with a baby with a cleft lip or palate, you can try a somewhat upright hold. You might need a hand or kind of figure out with pillows an upright hold, whether it be like a cross cradle upright or a football upright, and touch your rib cage, big wide C hold, and try to coordinate your compressions with baby's suckle. So most babies have a rhythm that is suck, swallow, breathe, suck, swallow, breathe, suck, swallow, breathe, suck, swallow, breathe. So as they suck, you're squeezing. It's kind of like you're forcing milk into their mouth so that any suction that they maintain, they can actually pull whatever you're helping them pull and swallow it. Now, in most babies that I've worked with cleft lip or palate, it does take kind of this active movement. It takes a lot of manipulation with the breast tissue. There is a feeder called a pigeon feeder where it's kind of like a modified bottle that works well, or that can work well. But sometimes the breast actually works better because there's more tissue to kind of maintain that seal. I have found that a lot of moms who have babies with a cleft palate, like a complete cleft, that is very, very hard to navigate as far as feeding is concerned. There is some that you can do some compressions and kind of get some milk to them, but oftentimes it is the relationship piece where you're doing kind of 10 minutes of compressions and practicing, followed by 10 minutes of pumping, and then giving that baby the expressed breast milk with a pigeon feeder or an alternate feeder. I cannot empathetically speak to how difficult it would be to have a baby with a cleft lip or palate, and I just want you to know that you're not alone. You have resources. Your story is your story, and every feeding story is very different. And so I hope that you find the help that you might need to support you in giving your baby breast milk if you want to, and support you in giving direct feeds if you want to. If you have any comments or any questions, please put them in the comment section. I would love to continue this discussion further, and I might even rope in my buddy so she can speak to it directly. You are exactly who your baby needs. I hope you are well. Thank you so much for watching these videos. If you like, please do like and subscribe to my YouTube channel. It helps me out. All right, take care, be well. You're exactly who your baby needs.